dear people. Hope you all are doing good. So welcome, and this is Harishini here, Assistant Professor, Department of Psychology, the Standard 5X Rajaratnam College for Women, Sivagasi. So I'm so delighted and happy to meet you all here, and let's continue with the happy learning. So the topic of today is going to be something interesting, and I think you all are going to enjoy and love it to the most. So fine, I think this new term called OCD is something which has been romanticized and fantasized across social media nowadays. It has been becoming a very new trend now, and I can say that it's the new normal, because like we can see many of the people are just letting them know that I have OCD and I'm just obsessed with this, or I have to do this compulsive behavior. So this thing has become the new normal now. So the topic of today will be OCD, that is obsessive compulsive disorder, right? So I hope you all are very eager to listen and learn about this in a very good way. So let's get started. So starting with OCD, first of all we all should know that that's nothing but obsessive compulsive disorder, which is a kind of mental health disorder, and I must say today this word is literally fantasized and the real picture of OCD is really so worse. So I hope we will understand this together. So moving ahead, the agenda or the talk of today's discussion will be, we will be starting with the introduction where I will be discussing the basic concepts, what is it and how it works and all. And next we will be talking about the etiology, which is nothing but the causes, the causal factors of OCD. Then we will be moving ahead with symptoms, because like the underlying concept of understanding a disorder is understanding its symptoms in detail, right. So we are going to learn about the symptoms in detail, and the next important thing is the diagnostic criteria, and here comes the main picture, because like only when a disorder satisfies the adequate diagnostic criteria, then only a sufficient clinical diagnosis can be done, right. So we are going to discuss about that as well, and we will be dealing with the treatment approaches, because every single problem in this world has a solution, right. So we are going to discuss about treatment and how it can be treated efficiently, and finally we will be wrapping up with a case study, because like we are discussing a variety of factors, and when we just apply it in a practical way in the form of a case study, I hope it helps us to understand, and we will close with the summary, right. So I hope you all are ready. So let's get started. So starting with OCD, what is its introduction, what is it basically? So you know very well that there are two different kinds of mental health disorders, that is psychosis and neurosis. So psychosis is something wherein the affected patients will not be having a touch with reality, whereas neurotic patients will be having a touch with reality. So this is the underlying difference, whereas talking about OCD, this is basically a kind of neurotic disorder, right. So what are its characteristics, how does it express itself? So the most important thing to be understood is, this is characterized by repetitive thoughts or repetitive patterns of behavior. So it gives you intrusive, repetitive, repeated thoughts which forces you or which urges you to engage yourself in compulsive behaviors aimed at reducing the anxiety. So this is what we call OCD. So you get a pattern of intrusive thoughts due to which you do compulsive behaviors, that is repetitive behaviors which are aimed at reducing the anxiety. Fine. So the statistical data tells us that this affects 1 to 2% of the world population, and talking about its onset, it typically begins in late childhood, adolescence, or preferably early adulthood as well, right. So starting with it, you know what happens is, this kind of intrusive thoughts or obsessions or compulsive behaviors interrupts in the daily life of an individual who is affected by OCD, which in turn causes psychological and emotional distress to the patient, because when they are having the urge to perform the compulsive behaviors triggered by the obsessions, it's obviously going to affect their day-to-day functioning, and this is so terrible, right. And that's why here I am tell you that the proper awareness or the proper understanding of OCD is really so important in today's world, so that it helps us in reducing the stigma, and it also helps us in improving the social support systems, which helps in giving efficient treatment to the patients with OCD. right? And I hope you understood the seriousness of OCD now, and this is something which is uncontrollable. The obsessions are really so terrible that you can't control them, which makes you to do compulsive behaviors. Fine? And then moving ahead with etiology. So what's etiology basically? It's nothing but the causes, right? The causal factors. So we all know that basically an illness has three major factors, that's bio, psycho, social factors, which means each and every illness has a biological factor, has a psychological factor, and also a social or an environmental factor. So talking about the biological factors, what's biology basically? It's your body, right? So in case of biological factors, we have two major reasons responsible for this, that is genetic lineage and the next is neurobiological factors. Fine? So the research indicates that OCD obviously runs in families, and we have to remember, dear people, it has a very good genetic lineage, right? So it runs in families. And next we are going to talk about the neurobiological factors. So I hope you all know that our brain is like a supercomputer and it has various parts which helps in giving you the thoughts and which basically helps you in everything you do, right? So as a result of neurobiological factors, say for example, abnormalities in the brain regions like the thalamus, the caudate nucleus and the orbitofrontal cortex. So these are all the parts which are involved in decision making, in giving you obsessions and making you anxious. So these are all the regions associated with these functions. So when there is an abnormality in any of these regions, obviously it's going to trigger OCD again, right? So this is all, we have discussed the biological factors. Next let's go to the psychological factors, and this is something which is really very personal, right? Because it varies from individual to individual like biological factors. So in case of psychological factors, we are going to discuss about cognitive distortions and irrational thinking or dysfunctional beliefs basically. So dysfunctional beliefs are nothing but when a particular individual has irrational beliefs about danger or harm or responsibility. So they have irrational beliefs basically. In the long run, it's obviously going to cause OCD. And talking about cognitive distortions, these are nothing but the errors in our cognition, right? So to be clear, you are catastrophizing something. Catastrophization is something but thinking about the worst always. So this is an example of dysfunctional belief and cognitive distortions as well. So when you do this, when you are catastrophizing things, what happens is you will be attracting only negative patterns, right, which in the long run can trigger OCD. Okay, and finally the environmental factor or else the social factors also. This is nothing but a trauma or a stressful life event. So when there is a very traumatic stressful life event which has happened to an individual, like the loss of a loved one or abuse or anything, this can basically trigger or worsen the OCD. So these are the three factors which are responsible for OCD, that's biological, psychological and social. Fine? And then moving ahead, let's talk about the symptoms, which is important. And for that, we have to first understand the OCD cycle. So this is a cycle which consists of 4 different steps. So the first step starts with obsessions. You get ruminated thoughts. The second step is anxiety, because you have the obsessive thought, you have the repeated thought. It's asking you to do something and you're urgent to do this, and because of this you get anxiety. So this is the second step. And third is unable to control the anxiety, you're not able to handle it, and so you are engaging in a repetitive behavior, and that is compulsion, right? And once you do the compulsive behavior, you feel a sense of relief because your anxiety is getting relieved now, right? So you are like, yes, I have done my job, right? Your thoughts are feeling good now, because once you are done with your compulsive behavior, you get a temporary relief, and after some time the hero comes again, and that's the obsession, right? So this is what the OCD cycle talks about. The obsessions come, they give you anxiety, and unable to control the anxiety, you do the compulsive behavior, and once you do the compulsive behavior, you get a sense of relief again, and that's temporary, and after that the cycle continues. So this is what we call as the OCD cycle. Okay, and then moving ahead, Now we are going to talk about the symptoms, which are really very important, because once you are going to screen a patient who is going to have obsessive compulsive disorder, these are the main symptoms which you have to look for. So the first thing is repeated thoughts. So that intrusive thoughts is the hallmark symptom of OCD, wherein it will be very repetitive. It may be repeated thoughts or images, like you will be having repeated fear of germs, or you may have the repeated fear of losing your loved one, or you may have the repeated fear of having sexual acts. So something which is really very repetitive and intrusive, right? And because of this, you perform the same ritual again and again. You do the things, the behavior is very repetitive, you repeat it again and again, so that it causes a clinically significant distress, or it's going to impact your daily functioning of life, right? And because of this, you are unable to control the unwanted behavior, you are unable to resist the urge to do the repetitive behavior. So this is really very important to note down. And after that, there will be absence of pleasure when you are doing the normal behavior, but when you do the compulsive behavior, you feel so relieved. This is something which we can easily notice in people with OCD, because when they are doing the normal things, there will be an absence of pleasure. But once they do the compulsive behavior, they feel so relieved, right? And after that, finally, what happens is, this obsessions or this kind of compulsive behavior should last for at least more than an hour in a day. So in a day we have 24 hours, right? So this kind of behavior should last for at least more than an hour, which in case is obviously going to affect your daily life, right? So these are the key symptoms which we have to look for in OCD, okay? And moving ahead, speaking about the diagnostic criteria. So well, I think you all know about DSM-5, which is nothing but Diagnostic and Statistical Manual of Mental Health Disorders, edition 5. So this DSM-5 is basically a classification system which helps in diagnosing the mental health disorders. So well, we'll discuss about the diagnostic criteria as per DSM-5 for giving a clinically significant diagnosis of OCD. Okay, so the first criteria is nothing but there should be the presence of obsessions, compulsions, or both for at least 2 weeks. Okay, this kind of behavior should persist for at least 2 weeks. And then moving ahead, the obsessions or compulsions should last for at least more than an hour in a day, which is going to give you a clinically significant distress. So this is the second criteria. And the third criteria is, the people having OCD will attempt a lot to control or suppress those obsessions with another act, right? So they try to neutralize the obsessions or the compulsions by engaging in another thing. They try a lot. It's really so hard because they try to suppress them, but they are unable to do this. So this is the third criteria. And the fourth criteria will be, the symptoms are not happening due to the effects of a psychoactive substance. So sometimes the intake of psychoactive substances can give us different symptoms, but in this case, the symptoms are not due to the effect of a psychoactive substance. And the fifth criteria will be, the disturbance is not well explained by other mental health disorders. So compared to the other mental health disorders, this disturbance is clearly explained by the presence of obsessions or compulsions, then yes, the criteria gets fulfilled. So these are the 5 points in the diagnostic criteria as per DSM-5 for OCD, which tells us about how to confirm a clinical diagnosis of OCD. Okay, and for this we are going ahead with DSM-5, that's Diagnostic and Statistical Manual of Mental Health Disorders, and these are the 5 eligibility criteria points for giving a clinical diagnosis of OCD, right? And then moving ahead, let's talk about the treatment, and here comes the lifesaver, because always remember there is a light at the end of the tunnel, right? So nothing is impossible, and there is obviously a very good way to explore. So talking about the treatment approaches, so well, I think you have to look into the psychological factors and also the biological factors here, right? So let's focus on the psychological factors first. So we are going ahead with CBT. Yes, you heard it right, it's our favorite, correct? That's cognitive behavioral therapy. And cognitive behavioral therapy is nothing but it's basically a cycle, that's TBA, thoughts, beliefs and actions. So once your thought gets converted into a belief, you do it into an action, right? So this is how you can just reframe your thoughts in a positive way. The cycle goes like thoughts, feelings and actions, right? Or thoughts, behavior and actions. So in this case, in case of OCD, we are using a specialized form of CBT, that is ERP. Very important, that's exposure and response prevention. So this is a very good kind of CBT treatment which is used in treating the patients with OCD, and it works like magic for many people. So exposure and response prevention. So what's exposure? You make the person exposed to something, you make them face something, right? So that is exposure. And response prevention is nothing but you try to prevent the response of the patient, and this is ERP. So say for example, the person is having an obsession of cleaning the hands again and again, right? So in this case, what happens is you just expose the patient to the stimulus, right? And the obsessions are just getting triggered. So the obsession is telling the person to do the compulsive act of washing the hands again and again. So in this case, what you're doing is you're consciously training your mind to refrain yourself from washing your hands. So this is what we call exposure and response prevention. And say for example, you are scared of cockroaches, and that's an obsession, right? So in this case, what happens is, first of all, your therapist might give exposure to a dummy cockroach, right? And in this case, you will be scared to death like anything. But when I do it on a regular basis at sufficient intervals, what happens is your response might change a little bit, because now you are training your mind in a logical way that the cockroach is not going to do you anything, right? So I expose you to the stimulus which you feel fearful about, and I help you in preventing the response as well. So this is what we call ERP, right? And then let's talk about the biological factors now. And however we concentrate on the psychological factors, your biological factors are also going to play a role, because certain abnormalities in the brain is also causing you OCD, right? And for this, a special kind of medication is being prescribed, that is SSRIs, selective serotonin reuptake inhibitors. So here what happens is, these kind of medications basically help you in reducing the power of obsessions, in breaking the cycle of compulsions, and they help in managing the anxiety much well. And for this, we go for this kind of pharmacotherapy, that is selective serotonin reuptake inhibitors. These are nothing but a prescribed group of drugs which is the first line of treatment for OCD. Fine? And yes, next we have a very good approach wherein we combine both of these approaches, that is CBT and medications, and that is what we call combining treatment. So here you combine both of these things, because the CBT works well for treating the psychological aspects, and the medications work well for understanding and treating the biological factors. Because when you combine CBT and medications, what happens is CBT is just going to focus upon your thought processes, it is going to focus upon your obsessions, right? And it's going to get converted into an action, right? So you are just dealing with the biological aspects. Whereas in case of medications, it's going to treat with the chemical imbalances or the neurobiological imbalances in your brain, and it helps in managing the anxiety well, right? So once you combine these two things, it works like magic. And finally, mindfulness is becoming very trending, or it's becoming very new now, because mindfulness is something which can be used as a treatment approach in a variety of mental health disorders, because mindfulness is something where you focus upon the present. That is the key aspect of mindfulness. So being mindful is like heaven. So in mindfulness, what happens is you focus upon the present moment, which helps in reducing the power of obsessions. So once your obsessions are reduced, the cycle of compulsive behavior will also be broken, and because of that your anxiety levels will be low, and it helps in effective stress management as well. So in case of mindfulness, yes dear people, you can practice mindful breathing, mindful chanting or mindful journaling. So any kind of things which helps in focusing you on the present moment will help in treating OCD better when combined with the other approaches. So always remember, every mental health disorder is treatable, and if we as a society together contribute to the well-being of the mentally ill patients, yes, definitely we can treat them better. Fine. And moving ahead, I'm just wrapping it up with a case study because it helps you in understanding the symptoms, diagnostic criteria and the treatment approaches better. So let's welcome Sarah now. So Sarah is a 28-year-old who has been struggling with OCD, and she was just struggling with OCD for the past 5 years. So what happens is, she is basically a very clean person, okay, but she is having OCD for the past 5 years and it has worsened recently. So it is very difficult for her to cope up with it. So what happens is, she lives alone and she has a supportive network of friends and family obviously, but she lives alone, and this kind of symptom is interrupting with her daily life a lot, and because of this her functioning is drastically reduced. So this is Sarah, and now let's discuss about the symptoms of Sarah and what kind of treatment interventions can be framed for her. So starting with the symptoms or the expressions given by Sarah. So these are the 3 major things which can be noted in Sarah, that is excessive hand washing, checking and rechecking and avoidance. So what happens is, since Sarah has OCD, what happens is, she has a death fear of contamination or a death fear of germs, because she has the obsession of being clean, being perfect and being ideal. And because of this, she does the repetitive behavior of washing her hands again and again, and because of her fear of contamination of germs, what happens is, she used to use the hand sanitizer again and again, and she'll never touch the surfaces which are dirty because she expects perfection, and because of this she uses a hand sanitizer and avoids the places which are dirty. So this pattern can be observed. And next is checking and rechecking. Obviously we know very well that your obsessions are going to trigger compulsive behaviors for you, and because of these obsessions, what happens is, she does the repetitive behavior again and again. Say for example, she checks her doors n number of times, checking and rechecking whether she has closed the doors properly or not, whether she has done the tasks correctly or not. She has the repetitive behavior, the compulsive behavior of checking the things again and again. And lastly, the pattern of avoidance can also be noticed. So in case of avoidance, what happens is, because of the continuing obsessions and compulsions, she is hard enough to avoid the places which is triggering her obsessions. So she started to avoid the places or avoid the incidents or avoid the situations which is going to trigger her obsessions, because she has the obsession of being ideal, perfect, clean, and she has the habit of checking things again and again, and because of this her daily life is drastically affected because she has started avoiding places which is triggering her obsessions and compulsions. So these 3 kinds of symptoms can be observed in Sarah very evidently, and with this we can conclude with the diagnosis of a proper obsessive compulsive disorder for Sarah. And the timeline matters because she has been affected with it for 5 years, right? So what are the treatment approaches here? Obviously we can save Sarah, right? There is always light at the end of the tunnel. So let's see how we are going to save Sarah. So here comes our hero, that's Dr. Lee, who is the therapist of Sarah. Okay, so let's welcome Dr. Lee. Yes, so Dr. Lee is going to help Sarah in managing these obsessions and compulsions better. So we never knew whether we will be able to completely remove the obsessions or compulsions. It's a little bit debateful, but we can help the clients to manage them effectively. Okay, so starting with Dr. Lee, what Dr. Lee did was, he practiced ERP, that is exposure and response prevention, which is a special kind of CBT in helping Sarah. because what he did was he started identifying the patterns or the fears of Sarah, because she had the fear of cleanliness or she had the fear of germs or being tidy. So he started identifying it and he made Sarah to expose to the stimulus, and he helped in response prevention as well. Okay. So, say for example, what Dr. Lee did was he asked Sarah to touch the handle of the door, and the moment she touches the handle of the door, she has the obsession, yes, your hands have become tidy, and her obsession is triggering her the compulsion that yes, go wash your hands fastly. But what Dr. Lee did was he prolonged the time between the obsession and the compulsion. He motivated Sarah to do this because she is having the compulsion to wash her hands immediately, but what Dr. Lee did was he made Sarah to wait for 5 to 10 minutes and then allowed her to wash the hands. So here you can see that the gap between the obsession and the compulsion is much larger. So when you focus on increasing the gaps larger and larger in the upcoming sessions, obviously we can help Sarah in reducing the power of obsessions, which helps in breaking the cycle of compulsions, right? And next, obviously, we are going to go along with the medications, we are going to prescribe, that's SSRIs, right? That is selective serotonin reuptake inhibitors. So this is a kind of pharmacotherapy wherein we will be dealing with the medicines, right? Because medicines are going to deal with the biological aspects of triggering OCD. So here Dr. Lee prescribed a SSRI named fluoxetine, which helps in managing the obsessions better, due to which there will be a reduction in anxiety. And finally, we are going to use mindful techniques, because mindful techniques matter a lot when combined with the other approaches. We ask Sarah to practice mindful breathing, which helps her in focusing on the present moment so that her obsessions might become a little bit weak. And we can also ask Sarah to do, after that we can also recommend Sarah to do the observation of thoughts, because once she observes the thoughts, like what and all thoughts it's coming to her mind, she can observe it efficiently, which helps in giving you an increased awareness about the thoughts she is having. So this also helps her in treating OCD better. So CBT, in that we use exposure and response prevention clubbed together with selective serotonin reuptake inhibitors, works like magic. And finally, you can also keep them on track by providing them with mindfulness techniques. So this is what Dr. Lee did, and it helped Sarah a lot in overcoming the symptoms of OCD, and she is much more able to live her daily life in a much very good way. And yes, that's all for today. So I wish to summarize the concepts once again, which we have learnt in today's session. So we started with basics of OCD, which is nothing but a mental health disorder characterized by intrusive thoughts, that is obsessions, which makes you engage in compulsive behaviors, that is repetitive behaviors aimed at reducing the anxiety. So we talked about the biological, psychological and social causes of OCD, and we talked about the symptoms, that is nothing but repeated thoughts, repeated behavior and unable to control the behavior, and all of the obsessions and compulsions are going to last for more than an hour in a day, right? And yes, we talked about the DSM-5 diagnostic criteria, which is really very important for giving a clinically significant diagnosis of OCD for the patients. And we also talked about the treatment approaches, which is the major concept to be discussed, wherein we talked about CBT, that is exposure and response prevention, medications like selective serotonin reuptake inhibitors and mindfulness techniques. And we discussed about the case study of Sarah. She was a warrior because she approached Dr. Lee, and Dr. Lee helped in managing the symptoms of Sarah in a very good motivational way. And always remember, mental health disorders with adequate care and with sufficient support can be treated. And yes, so with that, this is the end of today's session. So I always wanted to just tell you this important fact that mental health is always important, because there is no health without mental health. So always make sure that you are having a very good mental health, because when only you are good, you will be able to take care of others surrounded by you. So please focus upon your mental health and please help the persons in needy who might have a mental illness, because in today's world reducing the stigma related to the mental health problems is the most major task to be done, and every mental health disorder has a cure option for sure. The only thing we have to do is we as a society together should combine and we should work together for the well-being of the society. So with that, I hope you all understood the basic concepts of OCD and the treatment approaches related to OCD. So let's meet in the next session again. Thank you so much for your patience and happy learning everyone. That's all for the day. Take care. Thank you.